When Dr. Nick Goeders was a student here at LSU Health, he heard a lecture on morphine addiction in rats. That began a lifetime's work on the science of addiction.
I saw this seminar and I thought that was the most amazing thing I'd ever heard of. And so I went and asked him about working in his lab, and I had to jump through hoops, but eventually he let me work in his lab, and instead of morphine, I wanted to study cocaine addiction.
He began by looking into the effects of stress on addiction.
Stress is one of the contributing factors that leads to craving, that then leads to relapse. And it doesn't matter if you're talking about cocaine or meth or nicotine or other types of addiction. Stress can often be a contributing factor. And what we found was that uncontrollable stress, not stress that laboratory rats could control, but uncontrollable stress made cocaine more rewarding. If cocaine is affecting the brain's response to stress, what if we used another drug that would block that brain's response to stress? And so we started looking at different drugs.
They spent years testing different drugs, but each had drawbacks until an ordinary lab meeting sparked an idea.
It was, what would happen if we took one drug that would affect the brain response in one way and another drug that could affect it in a different way, and put those drugs together? Could we reduce the dose so that we wouldn't produce the types of side effects that we'd see if we used them by themselves? And it turned out we could. They produced an additive response, and that eventually led to EMB-001. We've done a number of studies in laboratory animals. That's how we started to determine that this would even work. We did the small clinical trial here in 2009. We then obtained funding from the National Institute on Drug Abuse to do all the FDA required work. That was completed. The FDA has awarded an IND, or an investigative drug status, to EMB, so now we're able to go into phase 1 studies.
For Dr. Goeders, these trials are the culmination of a lifetime of work, a potential treatment for addiction.
If this works the way I believe it will, it could help a lot of people who want to stop using cocaine, methamphetamine, smoking, and then it may even work for other stress-related addictions.